39-year-old Thanuja Nishanti was one of the latest victims of the dengue menace. She was admitted to the IDH hospital on the 20th with a fever where doctors had diagnosed her with dengue fever. Thanuja, who received in-house treatment over 10 days, succumbed to the fever this morning, offering her only daughter, aged 9.
This has become a high-risk area for dengue. 25 people who contracted the disease within a 50 to 100 meter radius have been hospitalized and some are even in the ICU. What are we to do about this? The authorities must turn their attention to this. That is what is needed.
According to data from the Epidemiology Unit of the Ministry of Health, 33 dengue-related deaths were reported in the first 5 months of the year.
An epidemic situation is being reported from the Western Province. In the Colombo district, Didehivela, Ratmalana, Mount Lavinia, Moratua, Kolonnawa, Piliandala, Maharagama and Bollasgamo medical officers of health divisions are reporting a high number of cases. We have also identified MOH divisions like Gampaha, Jayala, Wattala, Attanagalla and Biyagama. Panadura and Horana are two other MOH divisions where a high number of patients are being reported.
The director of the National Hospital in Colombo, Dr. Anil Jasinga, says that the number of dengue patients admitted to the hospital this month has doubled in comparison to April. 450 dengue patients are receiving in-house treatment at the hospital at present. The number of dengue patients being admitted to the Colombo South Teaching Hospital is also on the rise. Hospital Director Dr. Asela Gunawardena said that as of midnight yesterday, 167 dengue patients were receiving in-house treatment. A doctor at the hospital and 2 nurses are among those being treated for dengue. Director of the Colombo North Teaching Hospital, Dr. Mahinda Samaranayaka, says that 48 dengue patients are receiving in-house treatment at present. Among them are 9 small children. The director of the Lady Ridgeway Children's Hospital, Dr. Linton Padmasiri, says that 62 children who had contracted dengue were admitted to the hospital last week alone. Medical Superintendent at the Watupitiwala Base Hospital, Dr. Sisira Vijayasundara, says that 30 persons, including a small child, are being treated at the hospital at present for dengue. 40 dengue patients are receiving in-house treatment at the Colombo East Base Hospital. Hospital Director Dr. Ajit Tantanarayana says that dilapidated vehicles abandoned on the hospital grounds have become a haven for dengue-carrying mosquitoes. Dr. Dantanarayana adds that the fact that these dilapidated vehicles have been parked close to the ward where the patients are being treated is endangering their lives.
These are vehicles that belong to the Ministry of Health that are no longer in use. They must be auctioned off or moved to another location in the hospital. I have informed the relevant authorities to do this on several occasions.
Meanwhile, our cameras captured evidence of the negligence that has been shown to mitigating the spread of dengue at rapid development projects being undertaken in several parts of the Western Province. While rainwater has been retained in some locations, improper waste disposal has also created a haven for dengue mosquitoes.
What you can see here is a construction site on Muttaya Road in Colombo too. We witnessed here and elsewhere in Colombo that the collection of waste which is taking place parallel to development projects has created areas where dengue mosquitoes can breed.
Dengue මදුරුවන් බෝවීමට හැකියාව පවතින ප්‍රදේශ තියෙනවා කිහිපයක්.
Concrete veneer. When there is a concrete surface, water could be retained. Large numbers of mosquitoes could breed at these sites. Development is vital for us. At the same time, we must employ strategies to prevent mosquito breeding. Construction workers should know to monitor these locations. Chemicals to eradicate mosquitoes could also be used.
Meanwhile, public health officers who contacted Newsfirst yesterday following the airing of a news report on our primetime bulletin informed us that they are able to actively support and assist in dengue eradication programs. These officers, who are attached to the divisional MOH officers, have at present been entrusted with the task of eradicating malaria and filaria. It is notable that these officials have also undergone a year's training in mosquito eradication.
When malaria was on the rise, such incidents were reported. It was a difficult task for us to go from door to door in a bid to eradicate filaria. We have done such difficult tasks. If we are handed with that task, we will do it successfully. We have all the knowledge and data on mosquitoes, therefore it is not a big task for us.
Who is responsible for the failure to eradicate dengue? This was the question we posed to our viewers on our website www.newsfirst.lk. These were some of the responses we received.